Welcome to MediByte. I'm so glad you're here with us today. As a healthcare professional, I am here to guide you through a deeply sensitive but absolutely crucial medical topic, stillbirth. Look, I know this isn't an easy subject to dive into, but my goal with this explainer is to give you a complete, detailed, and really easy to understand breakdown of the clinical facts. Whether you're a medical student, a fellow provider, or just someone looking to learn, walking through this together is honestly the best way to grasp these complex realities. While this is for sure a heavy conversation, understanding the actual medical facts can be incredibly empowering for families. If you take away just one thing today, let it be this: you are not alone. By demystifying the experience and looking objectively at the clinical data, we can really start to chip away at the stigma surrounding this profound loss. Okay, let's jump in. Here's our roadmap for this explainer. We're going to define stillbirth, explore the causes, look at diagnosis and evaluation, talk about treatment and recovery, and finally, emotional support and future steps. Let's kick things off with Section 1, Defining Stillbirth. So, what exactly is it? Well, medically speaking, a stillbirth or fetal demise involves the death of a fetus before or during birth. But what's really interesting is that the exact timeline actually shifts depending on where you are in the world. In the US, the medical definition kicks in at 20 weeks of gestation or later. But if you look at the World Health Organization, they define it as fetal death occurring after 28 weeks. Recognizing that difference is absolutely vital when we're trying to understand global health data. And speaking of global data, I want you to just pause for a second and look at this number: 2 million. To put the global scale of this loss into perspective, there are almost 2 million stillbirths worldwide every single year. It's a staggering figure, right? And it highlights exactly why we need to talk about this, study it, and really understand it from a clinical point of view.
Moving right along to Section 2, Exploring the Causes.
When we're trying to figure out the why behind a stillbirth, we basically play detective and look at three main areas: the mother, the placenta, and the fetus itself. On the maternal side, we're looking out for things like severe preeclampsia, poorly controlled diabetes or thyroid disorders, extreme obesity, or substance use. When checking the placenta, issues like a premature detachment, which we call an abruption, or a prolapsed umbilical cord are prime suspects. And then we have fetal causes, like underlying genetic abnormalities, severe birth defects, anemia, or complications from having twins or triplets. It's like a giant complex puzzle. And honestly, sometimes despite all our advanced medical knowledge, the exact cause remains a total mystery. Because of all these variables, a patient's medical history matters immensely. As healthcare providers, we monitor expectant mothers incredibly closely if they've been through this before. Because unfortunately, a history of prior stillbirth can actually increase the risk in future pregnancies. Thorough clinical follow-up isn't just a suggestion here, it's an absolute necessity. Okay, let's head into Section 3, Diagnosis and Evaluation. Usually, this whole diagnostic process starts when the mother notices decreased fetal movement. Now, movements do naturally slow down a bit as the baby grows and runs out of room, but if movement stops entirely, we jump right in. The very next step is a non-stress test to monitor the fetal heart rate. After that, we'll often do a biophysical profile using real-time ultrasound to check the amniotic fluid levels and observe rhythmic breathing, movement, and muscle tone. Once a diagnosis is made, the clinical investigation really kicks into high gear. To try and pinpoint that underlying cause we talked about, doctors run a really comprehensive evaluation. We're talking extensive blood tests to check for infections, diabetes, or thyroid issues. We screen for clotting disorders like antiphospholipid syndrome. We run genetic tests to look for chromosomal clues, and we do a highly detailed physical exam of both the placenta and the uterus. All of these clues help us piece together what went wrong.
Which brings us to Section 4, Treatment and Recovery.
The treatment plan here depends heavily on the timeline of the pregnancy. If the fetus remains in the uterus, doctors might use medications like prostaglandins, misoprostol is a really common one, to dilate the cervix, followed by oxytocin to stimulate labor contractions. There are also surgical routes. For pregnancies under 24 weeks, a dilation and evaluation, or a D&E, might be performed. And if any tissue is left behind in the uterus, a procedure called suction curettage is used to clear everything out safely. And I can't stress this enough, getting this medical care promptly is absolutely critical. If a deceased fetus remains in the uterus for weeks without any intervention, the mother can develop a really dangerous, life-threatening clotting disorder called DIC, or disseminated intravascular coagulation. This condition causes severe internal bleeding and literally requires emergency blood transfusions to save the mother's life. It is a stark reminder of the very real physical risks involved here. Let's move into our final area, Section 5, Emotional Support and Future Steps. Physically speaking, postpartum care after a stillbirth mirrors the care provided after delivering a healthy baby. But emotionally, it is a completely different universe. Clinical guidelines are very clear on this. Women typically feel profound, shattering grief, and they absolutely require emotional support and counseling. Grieving is an expected and completely natural response here. Because the emotional toll is so huge, having a strong social support system and getting professional grief counseling is totally essential for a family's holistic recovery. The medical care cannot just stop at the physical body. So this leaves us with the big question that almost every affected family asks: what does this mean for future pregnancies? As a clinical guide, the honest answer is that it heavily depends on whether we successfully identified the cause of the initial stillbirth. If we figured it out, say it was a poorly controlled thyroid disorder, we can manage it actively in the next pregnancy. But if the cause remains unknown, we basically approach the next pregnancy on high alert, with advanced monitoring to protect both the mother and the baby. The loss of a pregnancy is a profound event, but by advancing our clinical understanding together, we're moving closer to a future where more of these tragedies can be prevented and families can get the answers they so desperately need. Thank you so much for joining us today on MediByte. I really hope this explainer helped demystify stillbirth for you in a clear, easy-to-understand way. Please take a second right now to like this video, share it with someone who might benefit from this knowledge, and hit subscribe on the MediByte channel. Your support is what allows us to keep bringing compassionate, clinical medical education directly to you. So as we wrap up today, I'll leave you with this thought. How can we better support those going through this invisible grief in our own communities? Think about it. Keep learning, stay compassionate, and we'll see you in the next one.